Integrating methods of quality improvement. Case scenario. Michigan Community Hospital has had an abnormally high rate of critical lab values in emergency room patients in the past 6 months. In particular, potassium, sodium, and glucose levels have been critically high. Providers have noticed that when these labs are corrected, the critical values seem to drop drastically. False positives are being speculated, but we're unsure why. Example would be Mr. Jenkins, who's a 52-year-old male who was brought into the ER by paramedics. On scene, he was started on IV fluids and was brought into the ER to correct his diarrhea and vomiting that he had had for several days. Mr. Jenkins had no history of chronic illness, and he was in general good health. Upon arrival, the doctor ordered stat labs. The nurse drew the specimens and sent them into the lab for processing. The patient's glucose returned from the lab dangerously high at 589. The doctor quickly ordered for the patient to be put on an insulin drip.